Then about the orthopedics part, there also will be like 5 to 7 questions, and we started to asking more from this orthopedics part nowadays. Okay, so this trend may even come and even persist for longer time. So just make sure you are reading orthopedics well and go, because there will be 6 and 7 questions, and out of which at least 4 to 5 questions will be from this field. Okay, so if you see, they will ask about this benign conditions, and if you see the single thing, if you see this single cyst which is having this fallen leaf side, okay, this fallen leaf side, okay, this single unicameral bone cyst or single bone cyst or simple bone cyst which is having this fallen leaf side, okay, fallen leaf side. So this is known as what? This is known as unicameral bone cyst, also known as simple bone cyst. So can anyone tell me in which of the following organism you will see this falling leaf motility? Falling leaf motility kahan dekhoge? Yeah, you will see this falling leaf motility in a case of giardiasis. Remember, giardia, girardia. So it will be having this falling leaf motility. And next, you will differentiate. Yeah, good. You will differentiate this two. It looks almost similar. It looks like a soap bubble. If they will tell you like it is different, but it looks almost similar to you, like aneurysmal bone cyst and GCT. How will you differentiate this aneurysmal bone cyst with the GCT? See, one is history. Next one is the X-ray. See, this aneurysmal bone cyst, it will be happening in younger, much younger. So if you see this bone plate, the bone plate will be unfused. So if there is unfused bone plate and along with this multiple cystic lesions, these are hemorrhagic. Okay, hemorrhagic means which is filled with blood. So this is what this is, aneurysmal blood cyst. Okay, aneurysmal bone cyst. This is made up of blood, and this happened in a young individual. Whereas if you see, this is GCT, giant cell tumor, which will be like a soap bubble, which can be seen in this distal part of this, around this wrist joint or around the knee joint. So this soap bubble, and it is occurring in this fused epiphysis. Yeah. So if you are able to see fused epiphysis, it is this GCT. And if you see this GCT, you know, it will be, they will be having this, they will tell this classical history. On evaluation, you will be able to see this. This is the epiphyseal lesion. See, it is a epiphyseal lesion, and once you press the lesion, you will be able to see this. If you are non-vegetarian, you know this eggs, right? And egg will be having a shell. Like once you crackle the egg, like how is, if you will crush the egg, you will get this sounds of crackling sound. Likewise, if you crush this one, you will be able to hear this crackling sound. That is classical feature of GCT. Yeah. Okay, yeah. Hope so. Like it won't recur. Like we'll pray for you. Like you will get through this exam as well. Don't worry, you are already having this much hope to be a part of this medical community, and just try to serve. And you just serve more people, you will get more goodness and good dua. Good. Fine. So this GCT, it will be occurring in this epiphysis. Okay, GCT, it will be occurring in the epiphysis, and it is also known as osteoclastoma. Fine. And next, if you are able to see this type of mushroom appearance, especially around the knee. If you are able to see this type of mushroom appearance, it is what it is, this osteochondroma. It is what it is, the osteochondroma, also known as exostosis. It is this exostosis, also known as osteochondroma. Fine. And next, if you see, they will ask you, there is a patient who is presenting with this osteochondroma. In options, they will give you which of the following should be evaluated for this malignancy. Then what are the, when you will consider this osteochondroma, which is being converted into a huge malignancy or a malignant condition, it is what? If the cartilage is more than 2 cm, or if there is a very rapidly increasing growth, or if the growth which will be started happening after skeletal maturity, and there is a loss of differentiation. So all of these features, it will lead to this increase in chances of malignancy. So agar koi bhi isme, means you get any of the symptoms in the question, so you will think of this is being changed into a malignant one. Okay, like for malignancy, increasing chances of malignancy. Okay, increase chances of malignancy. Okay, then if you are able to see this type of only one lesion, but remember there will be history. There is a, after taking NSAID or aspirin, the pain subsides. It will be written in the history. So it is what? It is the typical feature of osteoid osteoma. So if there is a, they will tell in history, there is a patient who is presenting with bony pain, and after taking NSAIDs, the pain is subsided, and the pain is mostly occurring at the night. So what you will think of? That is the exhaustos. Yeah, that is the aspirin. Okay, fine. And if you are able to see this, yesterday we saw in the case of hyperparathyroidism, you will see there will be blood collection because of this bony resorption, which is known as brown tumor. Whereas if you see this tumor of this phalanges or the fingers, it is known as enchondroma. It is known as enchondroma. It is known as enchondroma. Yeah, good, Dr. Ansh. Fine. And next we already saw about giant cell tumor. Next about this fibrous dysplasia. If you are able to see this type of shepherd crook deformity, shepherd crook. You know, right, the shepherd, like we know mutton at least we know, right? So the mutton will be come from the sheep. So the sheep handler will be having this type of stick, which is known as shepherd crook's deformity. Yeah. This enchondroma is associated with two syndromes. One is known as Maffucci syndrome. Okay, and this Maffucci syndrome, it will be having this soft hemangiomas, which will be associated. Okay, associated with soft hemangiomas. Okay, remember. Yeah, fibrous dysplasia. It is also associated with this McCoy-Albright syndrome. Like fibrous dysplasia is associated with this McCoy-Albright syndrome. Just remember, this is a one-liner. If you want to remember, it is a one-liner. It is associated with this fibrous dysplasia. This macules will be there. Okay, it is in a case of McCoy-Albright syndrome, and precocious puberty will be there. Fine. Next, if you are able to see this Ewing sarcoma, as we discussed, it is a radiosensitive one. And it will mimic this osteomyelitis. There will be pain. On X-ray you won't see anything, but if you see with a higher quality X-ray, you will be able to see there is this presence of this formation of onion peel. Yeah, good. It is the onion peel, and there is a presence of this diaphysis. It will involve around the diaphysis. Okay, And remember about this Ewing sarcoma. It will produce, we studied, right? Men, they are the pseudo people. They are very false people. So it will be having this three rosettes, which is this humerite pseudo rosettes in a case of medulloblastoma, Ewing sarcoma, and neuroblastoma. And here you will see this translocation of 11-22. E for Ewing, C for 11. E for Ewing, C for 11, 22. It is 11-22. Remember, it is 11-22, which is in the case of Ewing sarcoma. Fine. And here, if you are able to see this type of Codman's triangle, and along with this sunburst appearance. Okay, here you can see, but actually if you are able to see this type of sunburst appearance along with this Codman's tumor, both of them, it will be suggestive of osteosarcoma. And we know this osteosarcoma, it occurs after radiation exposure, so it will be radio resistant. See, radio resistant. So you are an FMGE, you came after so much of hurdles and problems, so you will be resistant to few problems. If it is temperature, you are from Kyrgyzstan, you are from Kazakhstan, and you studied in Russia, then the temperature is normal. If it is very cold, you will feel chalega koi na. Then if you are from the very hottest cities of China, then you will feel hot. Let it be hot. Okay, I am hot. Okay, that's it. So here in the case of osteosarcoma, you will be able to see two. This one is this sunburst appearance, and another one is the Codman's appearance. It is known as what? It is known as Codman's appearance. Fine. That's it. You need to know about this osteosarcoma. So that's why osteosarcoma, it will be resistant to radiation therapy. Okay, and it can be secondary to retinoblastoma. So radiation will cause osteoblastoma, osteosarcoma. Fine. Complication means like it will be secondary to radiation therapy, secondary to Paget's disease of bone. Okay, and it is also seen in a case of retinoblastoma. Retinoblastoma. Remember, fine. Next, we'll move on to this classification, which is known as Salter and Harris classification. See, in Salter and Harris classification, type 1, it is just through, means the red color one, it is the injury one. Okay, it is the injury one. See, this is the injury one. So the injury at this level, it is very minimal. So it is just straight vicross and it is very minimal. So it will be having this best prognosis. Okay, whereas if you see, if the injury is above, okay, it forms a different fragment. See, there is a different fragment. It is a normal bone is till this much. Whereas here, if you see, it is forming a different fragment once again. So it is known as what? It is known as this fragment. It is known as what? It is known as Thurston-Holland fragment. It is known as Thurston-Holland fragment. Okay, this fragment, it is known as what? It is known as Thurston-Holland fragment. Yeah. You know this mnemonic as Salter. S-A-L-T-E-R. So Salter means S for straight across, A for above. A for above, which is having this fragment which is known as Thurston Holland fracture, and L for low, it will be involving like a low, it is a third one, okay. Whereas in fourth, imagine it is a 4, okay, or like this 4, okay. So if you are able to see like a 4, means see, in a case of here, if you are able to see, there is a fragment above, but if you see, the both side will be like above and below will be involved. So it is this 2 or through, okay, it is the type 4. Whereas type 5, it is what it is, a huge compression force, and because of this compression, the growth plate, the green color growth plate is itself, it is not there. So there is this, it is the crush injury, good Dr. Shanavas, it is the crush injury which is causing this crushing of the growth plate. The growth plate will be crushed. Because of the crushed growth plate, the limb will be shortened or the limb won't grow. So the contralateral limb will be growing, whereas this limb will be short in nature. So okay, remember. So all this type 5 will be always retrograde. Like for example, the patient has fallen from somewhere, but he landed correctly, then he started going with normal routine life. After a few years, he feels like, yeah, this leg is or this hand is more lengthier, whereas this one is shorter. So what is the reason? When they do analysis, they found that this is because of this type 5 Salter plexus injury. Okay, remember. And you need to know this type 2, it is associated with this Thurston Holland fracture. It is associated with this Thurston Holland fracture, fine, or fragment, fine. And you need to know about this few fractures in the arm and forearm. They are very important. Okay. If you see about this first fracture, it is occurring at the level of supracondyle. So it is known as what? It is known as supracondylar humerus fracture. It is a supracondylar humerus fracture. Okay, see here, in the case of supracondylar humerus fracture, see, this is the humerus, this is the humerus part, this is the humerus part, and the fracture at this level. So if you see here, this elbow will be spared. So they will call this 3-point bony relationship. So this 3 points will be there. Okay, this 3 points, when you extend, it will be in a straight line, whereas when you flex, this will be there. So this 3-point bony relationship, this 3-point bony relationship will be maintained in a case of supracondylar fracture of humerus. So 3-point relationship will be maintained. Okay, and if it is not healed properly, this leads to this deformity which is known as Gunstock deformity, which is a cubitus varus deformity. It is a cubitus varus deformity, right? And we know, we already studied in anatomy, this humerus, along with this, there is a few nerves will be there and few arteries will be going on. So if you see anteriorly, there will be this brachial artery. If a fracture happens, this is the fracture bone, and this is, imagine this is the artery. It will go on kink. It will go on. You push to this artery, it will impair the blood supply. So this is the fracture, and this is the artery. It will go on kink. It will go irritate and kink. So the blood supply will be lost, and because of this loss of blood supply, we know it will lead to this syndrome which is known as compartment syndrome. Compartment syndrome, and if there is any compartment syndrome, we will remove by this physiotomy. Will resolve by physiotomy. Good guys, right? Will resolve by physiotomy. Good. Yeah. We'll put incision over the fascia and will release the pressure. Okay. Usually the normal capillary pressure is 30. If it is more than 30, we'll tell it is a compartment syndrome. Fine. And what is the first sign of this compartment syndrome? Yeah, guys. What will be the first sign? In question they will be mentioning that it will be what? It will be pain on passive stretch. It is the pain on passive stretch. Okay, pain on passive stretch. And at last only there will be a vascular injury. There will be a vascular. So last only there will be pain, and last there will be pulselessness. Okay, yeah, pain, pulselessness will be there. There will be paleness will be there. So first will be what? First will be this pain on passive stretch. Okay, itna yaad rakhna. Fine. Then if you are able to see, I told there is nerve injury. The nerve which is being most commonly injured here, it is this anterior introitious nerve. It is anterior introitious nerve, more common than this median nerve. So around this humerus, okay, this supracondylar, there will be two nerve. One is this median nerve, and the branch of it is this anterior introitious nerve, and this can even cause this damage. And we know if there is any damage in the anterior introitious nerve, this lead to this formation. This is normal OK, and this is OK. So it lead to this formation of improper OK sign. Okay, improper OK sign is seen in the case of anterior introitious nerve injury. Fine. And because of this compartment syndrome, okay, because of this compromised vascular supply, what will happen is that flexor compartment, जो भी anterior है, these are the flexors. So if it is flexors, it will be supplied by which nerve? It will be supplied by the median nerve. And because of this decreased blood supply over here because of this, due to this injury to this brachial artery, this flexor muscles go into the atrophy. अगर जैसे ही atrophy में जाता है, it will cause this, what will do? It will cause spasm and it will cause necrosis of this muscle, leading to this type of contracture, which is known as what? Which is known as this type of contracture, which is known as, what is the name of this contracture? It is known as Volkmann's ischemic contracture. It is known as Volkmann ischemic contracture. Okay, it is known as Volkmann ischemic contracture. Yeah, thank you, Dr. Mamanch. It is the Volkmann's ischemic contracture, right? And if it is done by if this fracture is being reduced, but if it is done by this massager or this professional bone setters, then sometimes they may dislodge this hematoma, leading to this complication which is known as myositis ossificans. It can lead to this myositis ossificans. ठीक है, बस आपको इतना याद रखना, ठीक है, ये आपको इतना याद रखना. Okay, then we'll move on to the next part where there is a fracture of this, lateral condyle of the humerus, where there is lateral condylar fracture of this humerus. We know this, I told you, like if they will mark this area and they will ask you which of the following nerve is passing near to this medial condyle. Okay, it is the ulnar nerve. Likewise, if there is this lateral condyle of the humerus fracture, this what will do? This won't grow. So kya hoga? This nerve will be passing hereby. This opposite side, it will start growing. Okay, the opposite side will be start growing. It lead to what? It lead to this increase in the length. So जैसे वो increase length होगा, so it will cause stretching. It will cause stretching of this ulnar nerve, causing this palsy, which is known as tardy ulnar palsy. हमें पता है, if there is an ulnar nerve palsy, it leads to the formation of this claw hand. It leads to the formation of the claw hand and adductor palsy. Adductor palsy, इसको check करने के लिए हम book test करेंगे, format sign देखेंगे. Then there is this introchanteric, palmar introchanteric, dorsal introchanteric. We'll use this adduction test and Agawa test. Adduction test and Agawa test. ये सारे करेंगे, ठीक है? Yeah, good. And this can have a complication which is known as non-union, which is lead to this cubitus valgus deformity, leading to this cubitus valgus deformity. Right? And this is classified as Garland classification. They will ask you, in which of the following fracture you will use this Garland classifications. Remember, this Garland classification is used for this lateral condyle of this humerus fracture. Lateral condyle of the humerus fracture. Fine. And here, remember, here the 3-point bony relationship. 3-point bony relationship is not maintained. Okay. As I told you, 3-point. This lateral, this medial epicondyle, lateral epicondyle, and this whole column fossa. So, if there is any damage up here, then this only 2 is there, 3 is not maintained, right? Whereas in a case of supracondylar fracture, the fracture is here. So, this 3-point will be normal. If you see here, it is like in a straight line. This 3 points in a straight line. Whereas if I am doing like this, the 3 point is in a straight line. Whereas here it is this. This is not 3-point bony relationship. So if there is any fracture of this lateral condyle, this will be gone. Okay, this will be gone. Okay, this will be gone. Okay, remember. Right. Next we'll move on to this few more forearm fractures. If you see first fracture, which is this fracture, this is Monteggia fracture. So how will you remember this Monteggia fracture? Remember it as Musa. Yeah. This one is Musa. Lateral is lateral condyle, so lateral. So see. In the case of this here, why it is ulnar nerve here? Here it is lateral condylar fracture. So lateral condylar fracture means this one won't grow. So this medial condylar fracture means medial condyle will tend to grow. So we know near to this medial condyle there will be this ulnar nerve. So because of this growth, it will cause stretching of this ulnar nerve, which is known as tardy ulnar nerve palsy. Okay. Whereas radial nerve means it is not related much to this lateral condyle. Okay. It will go around, mainly around this shaft. Okay, that's why we'll call it as during the shaft of humerus fracture. Around the shaft of humerus fracture, you will get this radial nerve injury, that is a radial drop. Okay, remember, don't confuse it. Whereas in like this, here if you see this Musa, here there is the fracture of this ulna and along with this radial dislocation. And we know around this radial head, there will be passage of this one branch of this radial nerve, which is this posterior introitious nerve. So this leads to the damage to this posterior introitious nerve damage. Right? So it is classified as Musa. Why it is Musa? In Monteggia, you see ulnar fracture. Okay, ulnar fracture along with SC. Superior radio-ulnar. Superior radio-ulnar dislocation. और हमें पता है around this head of this radius will dislocate and it will cause injury to this posterior introitious nerve. इतना याद रखो. This is the Monteggia fracture. So this is the fracture of the ulna. ठीक है, this is a fracture of the ulna along with this superior radial ulnar dislocation. So opposite of this, it is the Galeazzi fracture. क्या है इसमें? It is the fracture of the radius. Yeah, it is the radius fracture along with this inferior radio ulnar dislocation. Okay, dislocation. Okay, and it is the Monteggia. It is around this upper. It is around this upper. Okay, whereas or proximal third fracture. It is the proximal third fracture. Whereas this Galeazzi is the lower one third fracture. It is the lower one third fracture. Fine. Just remember these things. Next about this fracture, which is known as Colles fracture. Okay, Colles fracture. It is an remember Colles fracture is an extra articular fracture. अगर जो भी fracture it is not involving this joints, if it is extra articular, तब हम क्या कर सकते हैं? We can put this cast. Okay, and we can stabilize it. Fine. See, then Colles fracture is क्या? It is a fracture of this distal end of the radius along with this posterior displacement. Okay, ठीक है? Posterior displacement. This wrist will be posterior displacement. Okay, there will be dorsal displacement seen in a case of Colles fracture. There will be dorsal displacement seen in a case of Colles fracture, and if it is not healed properly, then it lead to this deformity which is known as dinner fork deformity. और इसको treat करने के लिए हम कौन सा cast use करेंगे? We'll use this cast which is known as hand shaking cast. Okay, and I forgot to bring the image. It is known as hand shaking cast. So remember, आप विराट कोहली को मिले, ठीक है, आरबीसी जीत गया, ठीक है, इस बार आरबीसी बोला कि कप नाम दे, ठीक है ना, ठीक है, कप नाम दे, तो इस साल कप नाम दे, तो when they told this इस साल कप नाम दे, they got this cup. Okay, so you also passed your FMGE examination. So you went to meet this Virat Kohli. Okay, once you meet the Virat Kohli, अब क्या पहले क्या करोगे? You will do what? You will do hand shaking. फिर बोलेंगे चलो डिनर पे मिलते हैं, ठीक है. सो रिमेंबर टू थिंग्स, लाइक यू विल हैंडशेक विद विराट कोहली एंड यू विल टेल या विल कैच अप फॉर अ डिनर, ठीक है, पूछोगे, ठीक है ना, बताओगे नहीं, पूछोगे, ठीक है ना, you will ask him, like first you will do handshake. So remember, in the case of Colles fracture, you will be having this handshaking cast, and if it is not healed properly, okay, then it will lead to this dinner fork deformity. ठीक है, impossible, ठीक है, क्या कुछ चीज लगता है impossible है लेकिन possible हो गया, ठीक है ना, लेकिन होगा, ठीक है ना, जो भी like because like imagine like in few times we also thought like यार ये मेडिसिन में क्यों घुसे, ठीक है ना, हमें और कुछ और प्रोफेशन चूज करना था और बिंदास रहना था, लेकिन हम मजबूरी ये हो गया, लेकिन नहीं पता कैसे हुआ, ठीक है ना. वैसे ही एफएमजी एग्जाम भी ऐसा ही है, ठीक है, लगता है इम्पॉसिबल है, मुश्किल है, नामुमकिन है, ठीक है ना, बस लेकिन हो जाएगा, ठीक है ना. Everyone think like FMG is very much tough, it is very much impossible, like लेकिन once you done with it you will think इतना ही है, बस इतना चाहिए. So just remember it is possible. Next about this reverse Colles fracture, which is known as what? Which is known as Smith fracture. So instead of posterior shifting, if this wrist is shifted to this anterior side, it is known as what? It is known as reverse Colles fracture, also known as Smith fracture. And in Smith fracture, there will be what? There will be this deformity which is known as palmar or anterior dislocation or anterior displacement. Okay, it is this Smith fracture. So it is the garden spade deformity. Next, we'll see one more fracture where there is just intra-articular fracture. Intra-articular fracture of only one segment around this abductor pollicis longus. It is known as what? It is known as Bennett's fracture. It is known as Bennett's fracture. ठीक है, it is the metacarpal, and अगर एक side dislocate हो गया तो क्या होगा ना, means this will displace the bone fracture segment, तो इसीलिए ये इधर आ जाएगा. See, usually this will be like this and there will be a fragment. So usually if only one part means then it will be get dislocated, क्योंकि because of this tendon pull of abductor pollicis. अगर दोनों side है तो it won't dislocate. So this is what? This is the, if it is fracture of two tendons, it is what is the Rolando fracture. It is the Rolando fracture. Fine, just remember. Next we'll see about this dislocation. Okay, anterior and posterior dislocation of shoulder and hip. ठीक है, दोनों का आसपास सेम ही है, तुम्हें याद रखना. You know Shah Rukh Khan, like actor. If you see Shah Rukh Khan, he will be doing this move, like he is famous for this move, right? This one. Okay, so see, this is the Shah Rukh Khan move. और you passed FMG and घर में बोल रहे बेटा बेटी शादी कर लो, ठीक है, लेकिन तुम्हें तो प्यार करके ही डूबना है, तो means but you don't want to do just for a sake of sorry, so you want to make a relationship, then you want to get married, so you try to propose her, ठीक है, So means you want to go and propose her or him. Okay. So if you want to propose, you will propose in front of them. Okay. You will go and propose in front of them. So how will you propose? You will propose them anteriorly with a Shahrukh pose. Okay. You will abduct your hand and you will externally rotate. So this is what? This is anterior dislocation. So this is the typical feature of this. Yeah. This is the typical feature of this anterior dislocations, and you are proposing not in her back. क्योंकि if back में तो कैसे देखेंगे, ठीक है? तो it is anteriorly she or he is seeing. So you are doing your hand and you are proposing. So yeah. So if you see this one, this is in the case of anterior dislocation. This is what? This is abduction along with this external rotation. It is the abduction plus external rotation will be seen. Whereas in the case of posterior, it will be opposite. It will be what? It will be adduction and internal rotation. It is the adduction and internal rotation will be seen in the case of posterior dislocation. Okay, dislocation. Okay, and in the case of posterior dislocation, you will be able to see this type of light bulb. Okay, this is this type of sign which is known as what? Light bulb sign. It is known as what? Light bulb sign. Okay, this is known as what? This is light bulb sign. This is seen in the case of posterior dislocation of shoulder. Okay, so there will be abduction and external rotation seen in the case of anterior, whereas adduction and internal rotation seen in the case of posterior dislocation. Okay, so ये dislocation को देखने के लिए we have few tests. One of them it is known as Dugas test. You will tell the patient to touch his opposite shoulder. Okay, if there is any shoulder dislocation, then the patient cannot go and touch his opposite shoulder. Usually we can touch, but this patient cannot go and touch his opposite shoulder. It is known as what? Dugas test. And we have another test which is known as Hamilton roller test. See, even like if I keep something here, then there will be difference. There will be difference. There is a space there, right? So because it is normal one. Whereas if you see in this image, if there is shoulder dislocation, there will be this loss of counter leading to this thing. Okay, leading to this, which is known as Hamilton ruler test. So keeping the ruler and assessing it is known as Hamilton ruler test. So remember, Dugas test, Hamilton ruler test, and Callaway test and Briand test. So if you can remember, just remember this two things. What is this? Dugas test and Hamilton ruler test. Okay, and how will you reduce this? You will give traction in the case of anterior dislocation. You will do traction, external rotation, then finally adduction and medial rotation. First, it's already there, so you will give traction first, you will do more external rotation, then finally you will tell to adduct and you will medially rotate. So it is known as what? It is known as Colles method of reduction. It is known as Colles method of reduction. इतना याद रखो. Fine. And if there is any recurrent dislocation, तो क्या होगा? This is the glenoid labrum. This is the humerus का head. तो क्या होगा? When it's dislocated multiple times, then this anterior inferior part of this glenoid labrum and this posterior superior part of this humerus will be having this lesion. So if it is anterior inferiorly, it is what? It is the Bankart lesion. Whereas hill matlab fade apart. Okay, so this hill will be in top. So yeah, hill will be in top. So Hill-Sachs lesion will be in the posterior lateral in the superior aspect of this humerus. Whereas anterior inferiorly we will see this Bankart lesions. Okay, yeah, in the top. Yeah, good. We will see this infraglenoidal region which is Bankart, and Hill-Sachs it is the posterior lateral region. Posterolateral region. The same for this hip dislocation. Okay, the same Shahrukh pose. See, remember in the case of hip dislocation as well, the anteriorly the same. It is what? It is this abduction. It is the abduction. See, the leg is abducted and abduction and external rotation. Okay, in anteriorly. Okay, it is Faber. Okay, whereas in the case of posteriorly, you see, means Faber means it is flexion. See, the leg is flexed, whether it is dislocated or non dislocated. ठीक है, कोई फर्क नहीं पड़ रहा. Both of them there will be a flexed leg. So flexion along with here if you see, because of the dislocation there is adduction. Now here it is adducted. So adduction and internal rotation. So Faber in the case of anterior dislocation, posterior dislocation, whereas in the case of Faber in the case of anterior dislocation. So just remember, it is this abduction acceleration for all the anterior dislocations, either shoulder or hip. Okay, इतना याद रखो, बस काम हो जाएगा. ठीक है? They will give this X-ray and they will ask you, which of the following dislocation is this in this left leg? See, in left leg, it is what? The leg is adducted. The leg is adducted. So क्या है? It is the anterior dislocation. It is the posterior. Leg is adducted. It is the posterior dislocation. Whereas if you see this leg which is adducted, which is abducted along adducted, then it is what? Then it is a posterior. It is a posterior dislocation. Okay. hypoglycemia before lunch. Okay, it is a posterior dislocation. The posterior dislocation. Okay, just remember. Fine. Fine. Next, we'll move on to this joint conditions. One is osteoarthritis. Remember about the first condition, which is rheumatoid arthritis. Remember? Okay, rheumatoid arthritis. Rheumatoid arthritis. Who will be more crying? Okay, is it male or female will be crying more? Okay, who will be crying? The females will be crying. ठीक है, रोना. ठीक है, रोना. Remember, rheumatic arthritis के लिए, rheumatoid के लिए रोना. याद रखो. ठीक है, the females will be crying because of this mood swings. Okay, yeah, female will be crying. So because of female will be crying. Remember why she is crying? Because she asked the god like, whatever joint you want to take, but I want to apply nail polish. So leave the distal part of the hand. Okay, ठीक है ना, रोना है लेकिन सुंदर बन के रोना है. ठीक है ना, so she will cry. So it will be most commonly seen in females and it will spare the distal interphalangeal joint. ठीक है, बस तुम्हें इतना जानना है, it will spare the distal interphalangeal joint. ठीक है, हो गया, बस मैंने कॉन्सेप्ट अभी बना लिया. ठीक है, कॉन्सेप्ट बना लिया, फिर आगे बढ़ते हैं. ठीक है, यहाँ fine. If you see about this osteoarthritis, it will be opposite. So it will be involving this distal interphalangeal joint. It will be involving this distal interphalangeal joints. It can be most commonly seen in both males and females. And remember, it is the involving this distal interphalangeal joint. This is the differentiating factor from the other rheumatoid arthritis. Fine. So the first joint it will be involving, it is the carpometacarpal joints, and there will be involvement of this distal interphalangeal joint. Okay. Okay. Fine. Then if you are able to see this, there are two nodes. One is known as Hodgkin nodes. These Harbonder nodes, they are present at this distal interphalangeal joint. It is known as Harbonder nodes. Whereas PIP will be showing this Bouchard's nodes. PIP will be showing this Bouchard's nodes. So BP, okay, Bouchard's nodes will be seen in the case of proximal interphalangeal joints. Whereas DIP will be having what? Will be having this Harbonder nodes. Remember. And what are the X-ray findings? If you see, this joint space will become narrow joint space, and there will be small osteophytes will be there, like small tukra, means there will be small calcium deposits which are known as osteophytes. Okay, and finally there will be sclerosis will be there, and it can result into this genu varum. Okay, varum. Okay, varum. Okay, because we know that varum which forms the rum. Okay, it is O. Okay. When you draw this O, it should accommodate the O. Okay, so you need to keep rum inside. You keep the rum bottle. Okay, rum bottle. Okay, it is a bottle of rum. So it is genu varum. Okay, genu varum, it will accommodate O also, rum bottle also. So it is the genu varum. It is this genu varum. It is seen in the case of osteoarthritis. Okay, osteoarthritis, it is a degenerative disease. It may involve this DIP and PIP. Okay, the first joint to be involved, it is the carpometacarpal phalangeal joints. Okay, so इसको treatment के लिए usually osteoarthritis के लिए it is a degenerative disease. So we'll give this physical therapy, weight reduction therapy, or if there is pain, we'll give NSAIDs. Pain will give NSAIDs, and in some extent we can go for this intra-articular injection of steroids, or because of this narrow joint space, हमें उसका inflammation भी कम करना, space भी increase करना, so sometimes we can use this hyaluronic acid as well. So this is a simple initial management. Okay, अगर कुछ भी नहीं हो रहा तब like most commonly will go for total knee replacement. ठीक है ना, तो पहले इतना था बहुत, अभी तो बहुत करीब आ गया और पास आ गया, means it came much near to it, so it will do total knee replacement. Okay, इतना याद रखो. So osteoarthritis, it forms O, so it will cause this genu varum. Then it will involve this DIP, PIP, and the first joint to be involved is the carpometacarpal phalangeal joints, and there are two nodes, Harbonder nodes and Bouchard's nodes. Harbonder nodes at the level of DIP and Bouchard's nodes at the level of PIP. Remember. And the X-ray, you will be able to see there is a reduction joint space. Okay, so initial management is lifestyle management along with NSAIDs. और कुछ नहीं हुआ तो total knee replacement कर दो. Okay. Then about this rheumatoid arthritis, as I told you, it is most commonly involving. This rheumatoid arthritis, it will be most commonly involving in females, and it most commonly involves this joint. It will be involving this joint, which is the PIP. And here the most common joint, if you see, it is this MCP joint, wrist joint. This will involve this wrist joint also, metacarpal phalangeal, and mainly this distal interphalangeal joint. And we will be having these two deformities. One is known as swan neck deformity, another one is known as boundless deformity. If you can make this swan neck, it's fine. But don't confuse this with also a swan neck. So remember, if you not, then just see, you have this button, right? This buttonhole. See this buttonhole. Likewise, you need to make the buttonhole. See, take your finger, like bend like this. Here now you will be able to see this buttonhole here. Here you will be able to see the buttonhole. So remember, this is the boundless deformity. So boundless, it is the buttonhole deformity. Okay, boundless is the buttonhole deformity. See, here At the end of distal phalangeal joint, you will be able to see there is what? There is hyperflexion, like hyperextension. Here it is the hyperflexion at the rate of proximal interphalangeal joint. So this is the Bowden's deformity. Whereas opposite of this, it is the Swan-neck deformity. See Swan-neck, it is what? It is this hyperextension at here and hyperflexion at the distal interphalangeal joint. Itna yaad rakho. Okay? Yeah. So just remember one thing and make the questions correct. Okay? At the end of the day, to make questions sahi karna. Okay? Na questions sahi karna. Okay? Just remember. Yeah, this is Swan-neck deformity and Bowden's deformity, and sometimes it will show this ulnar deviation, which is known as V deformity. Okay, itna yaad rakho. And here you will able to see an X-ray, you will able to see this periarticular osteopenia. Okay, and here there will be symmetrical joint space narrowing. और हमें पता है डायग्नोस करने के लिए हम दो एंटीबॉडीज यूज कर सकते हैं, वन इज एंटी सीसीपी एंड एंटी रूमेटॉइड फैक्टर. और मोर स्पेसिफिक इट इज क्या? इट इज द एंटी सीसीपी, इट इज द मोर स्पेसिफिक वन. ओके, एंड ओके, मोर स्पेसिफिक वन. सो अक्यूट स्टेज के लिए हम क्या क्या कर सकते हैं? वी कैन यूज स्टीरॉइड्स और एंटी इन्फ्लेमेटरी ड्रग्स लाइक स्टीरॉक्स. फिर उसके बाद हम क्या कर सकते हैं? डीएमआर्स लाइक डिसीज मॉडिफाइंग एजेंट्स फॉर दिस रूमेटॉइड डिसीज. क्या? हाइड्रोक्सीक्लोरोक्विन, सल्फासेलाजिन, मेथाट्रेक्सेट. ओके, हाइड्रोक्सीक्लोरोक्विन, sulfasalazine and methotrexate. अगर methotrexate दे रहे then we need to give supplement with folic acid as well. ठीक है? तो biological infliximab अगर बहुत serious है तब we can give more biological one like infliximab, etanercept and adalimumab. Infliximab, etanercept and adalimumab. Infliximab, adalimumab, like etanercept and adalimumab. ठीक है? 3 ड्रग्स देंगे. ठीक है? Next you say male. अभी मेल पे आते हैं. The male is having complaints of unable to bend. Okay, unable to bend, and he's having features of pain around the sacral region. Okay, around this pain around the sacral region. So these two, and along with this, he's unable to move and make movements in this vertebral level, or unable to bend. So all of these features, it will be suggestive and most commonly morning and males who is positive with HLA-B27. It is what? It is the ankylosing spondylitis. Okay, ankylosing spondylitis. Okay, and in the case of ankylosing spondylitis, here there will be a stiffness of the back will be identified by this test, which will tell them to bend, which is known as Schober's test. और हम radiologically देखेंगे, then the central, there will be this central calcification, which is known as what? Dagger sign. Then if you see, there will be this inter-IVD also will get calcified. So this one will be known as what? Bamboo spine. And there will be inflammation around this vertebra, leading to this. Initially there will be shiny corners, followed by this squaring of vertebra known as squaring of vertebra. Next, this shining, it is known as Romanos sign. It is known as Romanos sign. Okay, and it is HLA-B27 positive, and it will be associated with this uveitis. I mean, it is associated with this uveitis. Okay, mostly the anterior uveitis. Okay, it is this ankylosing spondylitis, which will causes inflammation over this sacroiliac joint. Okay, sacroiliitis in young male females, which is HLA-B27 positive. Okay. Next about the pseudo-gout and true gout. Pseudo-gout and true gout आपको याद रखना है. Pseudo-gout, it is a erosive disease. मतलब it produces erosions. ठीक है? Rat bite erosion. जैसे चूहे काटते हैं ना, चूहे means rat, how it come and cut to the carrots. Likewise, it will come and cut your bones. See, this is the rat bite erosions. Okay, rat bite erosions you will see in the case of bamboo stick appearance with central spurs. We will see in the case of Bacillus anthracis. Yeah, nice, good catch. See, this gout, we know it is due to the increased level of uric acid. Okay, and this gout, you will able to see this type of rat bite and erosions. Okay, which is known as Martel's J sign. Okay, and in the case of pseudo-gout, it is most commonly seen in knee joints. And if you see here, there will be a presence of this calcification here. This is known as meniscal calcification. Okay, agar erosions unhone bola, then it is gout. If they say it is the calcification of this menisci, then you will think of it is what? It is this pseudo-gout. And remember how they will differentiate. How they will ask you how we differentiate. We'll do a test which is known as, with microscopy, we'll go for this bireferencement testing of the crystal. Okay, whereas in the case of pseudo-gout, everything will be P. Pseudo-gout, pseudo-gout, it will be positive for bireferencent. Okay, bireferencent, because it will be having this calcium phosphate. Okay, calcium phosphate, especially calcium pyrophosphate. Remember, it is pseudo positive and it will be calcium phosphate crystals. Okay, whereas in the case of gout, it will be needle. It will be needle shaped crystals. It will be negatively. N for N, it is needle and it is negatively bireferencent. birefringent. Okay, remember, and the crystal is monosodium urate crystal. Okay, and here the first joint it will be involved is the first MTP, whereas in the case of pseudogoid it will be forming the calcification inside the meninges. It's like not meniscus, so there will be a meniscal calcification. Meniscus हमें पता है वो knee में होता है, so pseudogoid it is classically involving this meniscus. Okay, in pseudogoid we will able to see rhombus, rhomboid shape. See, these are the signs you need to know. Next one about this important one, this is this pediatric orthopedics. They will ask one question from this pediatric orthopedics. What is developmental dysplasia of hip? Because means India it is very rare because we keep the children in the godi mein bitate hain, theek hai na. So because of this there is less recurrence, less incidence of EDH in India. Means godi means madi loga rakha, means like they will keep their baby here, right? So it is DDH. Okay, so the inverse in the case of DDH, it is this displaced hip which is causing this dislocation. So usually this is the normal hip and this is dislocated hip. So you can see this line which is known as Shenton's line. So there is a break in this Shenton's line. There is a break in this Shenton line. Okay, there is a break in this Shenton line. So this is a dislocated line. Okay, dislocated one. So here for diagnosis we'll use, as I told, this is children, we'll use MRI. We will use MRI and start with ultrasound. So we'll start with ultrasound, we'll go for ultrasound, we'll go for MRI and we'll do two tests. See, two tests. What are the two tests? If you go to bar, what you will do? If you go to bar, what you will do? You will keep on adding the pegs, So if you keep on adding the pegs, at some point you need to come exit. So finally it is exit, it is dislocation only. But in a case of Barlow's test, you will keep on adding. So if you do adduction and the hip dislocates, it is known as Barlow's test. Whereas it is opposite, which is this Ortnadi test. If you do reduction by abduction, it is what it is, the Ortnadi test. Okay, Ortnadi test, it will be entry. Okay, just remember. Okay, entry. So Barlow's, you will keep on adding the pegs, so it leads to this exit. So it is known as Barlow's test. Okay, and for this management we use two things. One is known as Pelvic harness. So Pelvic harness, and this is the von Rosen splint. Okay, von Rosen splint, which you use for this 0 to 6 months time. For this 0 to 6 months time. Yeah, that is barley. Yeah, that is bro one. Yeah, good. Fine. Then for 6 to 18 months, then we will reduction with the hip spica. Okay, also known as bacillus cup. Hip spica will keep. Just search this and we'll get it. Fine. Next one is known as perthes. Perthes is nothing but it is a necrosis of this femoral epiphysis. This femoral epiphysis become necrosed because of this avascularity or because of this obesity or because of some idiopathic reasons. Okay, so we know if there is any necrosis of this head will be seen as yearly with the help of MRI, and we know it is a pediatric condition, फिर भी हम MRI करेंगे, ठीक है. So treatment के लिए हम एक कास्ट लगाएंगे, उसका नाम है broomstick cast. Okay, then what this here you will be able to see in X-rays, you will be able to see this sagging rope sign, also known as present sign, you will be able to see here. Fine, just see as a mnemonic this Perthes disease, it is avascular necrosis of this femoral head, and along with this for diagnosis we will use MRI. Okay, the next condition is known as CTEV, congenital talipes equinus and varus. Fine, congenital talipes equinus and varus, and if you see this will be most commonly prevalent in India, and it will be characterized by 4 deformities. One is this cavus, adduction, varus and equinus. Cavus means exaggeration of this medial arch, and adduction means exaggeration of this forefoot adduction, and varus means there is subtalar. Varus its level happens at the level of subtalar, and equinus means ankle joint. Okay, equinus means ankle joint. So if you are able to remember, well and go. If not, remember it is cavus, adduction, varus and equinus. Cavus, adduction, varus and equinus. बस इतना याद रखना. Okay, in depth में नहीं जाना. Okay, for this treatment we'll use this type of splint. Okay, what is the name of the splint, guys? What is the name of the splint? It is known as Dennis Brown splint. It is known as Dennis Brown splint. Okay, it is known as Dennis Brown splint, and they will be having this special shoes. If you see normal shoes, it will be this side. Whereas in a case of CTV shoes, we will be having this outer rise and without heel. Okay, outer rise without heel. So this is a classical for this CTV patients. Okay, CTV patients. So itna yaad rakho. Fine. And initially we'll do for this Dennis Brown splint either present in late, then we'll do for orthodesis procedures. We'll go for this orthodesis procedures. Okay. Then about these 2 diseases, we studied them in biochemistry as well. See, TAVI means first we'll see rickets. Rickets, it is what it is, decreased calcium. Decreased calcium, calcium decrease. Then because of this, the bone formation will be impaired. Okay, bone formation will be impaired. And radiologically आप कैसे देखोगे? Okay, radiologically आप देखोगे these 3 findings which are CSF, cupping, splaying and fraying. ओके, कप बन रहा है, ठीक है, कप बन रहा है, ठीक है, अंदर में थोड़ा थोड़ा फायर जैसा फ्रेइंग है, ठीक है, फिर उसके बाद साइड में स्प्ले हो रहा है, ठीक है, तीनों cupping, flaying and spraying. All of this thing will be seen in case of rickets. Cupping, flaying and fraying, cupping, flaying and spraying. And as I told you, this rickets, it is painless condition. So whatever thing, there will be a ricketic rosary will be there. There will be a windsweep deformity will be there. There is a genuvalgum will be there. So all of them, it will be painless in nature, and all of the manifestation will be manifest in bones. There will be a ping pong skull, also known as craniotibis will be there. So this is a typical feature of this rickets. और इसको treat करने के लिए मैंने उसी दिन भी तुम्हें बताया कि it is the regimen which we use, which is known as Strauss regimen, where we'll use this single dose of vitamin D, which is around 3 to 6 lakh based on the weight, or either IM or oral dose. IM or oral dose. This regimen is known as Strauss regimen. Okay, and here you will be able to see ricketic rosary, and because of this diaphragm pull on this ribs, it will be having this Harrison's groove, and you will be able to see a line which is known as white line of Frankel. When you start giving the treatment, there will be new calcification will be happening. It is known as white line of Frankel. It is known as white line of Frankel. Fine. Next, leg will be having this knock knees, or this means windswept deformity and genuvarum and genuvalgum. Okay. Then scurvy, मैंने बोला scurvy will cause, it is due to the defect in this vitamin C causes hydroxylation of lysine and proline. Hydroxylation of lysine and proline. Okay, and this hydroxylation of lysine and proline will be used in a case of, helpful in formation of collagen. If there is a problem in this collagen formation, then it leads to this improper collagen formation. अगर ये improperly collagen बना, then it leads to this leaky blood vessels and causing this periosteal hemorrhages. It will cause this periosteal hemorrhages. ठीक है, periosteal hemorrhages. तो याद रखो, if you want, you can remember something like, तुमने क्या किया? You passed your FMGE examination and you went to a mall, okay, and you went for a movie, okay, ठीक है, with your friend or your own, fine. हमें पता है, means they told the movie will start at 8:25 PM, लेकिन you went at 6 PM. तो अब क्या करोगे? Okay, अब क्या करोगे? आप फूड जोन में जाओगे, ठीक है, फूड जोन, ठीक है, remember, okay. So there is a zones will be available here. तो फूड जोन में आप क्या खाएंगे? बर्गर खाएंगे. We'll eat burger, okay, burger, okay. Then we'll eat the burger, and we know this burger sometimes it will be having this French fries, right? And this French fries will come and nick your oral cavity, and it will cause bleeding. Okay, इतना याद रखो. Bleeding, okay, because of this side, like this, the burger will be there, and side there will be this, because like spur like this potato chips will be there, right? French fries will be there. So okay, there will be a French fries, and you are taking a French meal, and there will be this burger, there is a French fries. So it is just a story, just remember. Here you will be able to see this burger, okay, this burger. So here you will be able to see this Wim burger sign, and burger is also ring. This is the Wim burger ring here. Then there is this, we are taking this French fries. So remember, it is a Frankel. It is a French fries. Remember, it is a Frankel line. F for F, it is the Frankel line. And here it will be showing this type of spurs, like your French fries. It is known as Pulkin spur. So there will be Wim burgers ring along with this Pulkin spur and along with this white line of Frankel. So all of them will be there. If you are able to correlate the story, keep it. If not, just leave it and remember these things. Wim burgers line and white line of Frankel, and along with this Pulkin spur, and there will be a features of bleeding, gum bleeding. Okay, and mostly this scurvy, it will be painful in nature. Scurvy will be painful in nature because there will be hemorrhage and will lift up the periosteum, and we know a periosteum is highly innervated. Okay, so it will be painful in nature. Okay, इतना याद रखो. Then we'll move on to this tibia vertebra. We know this TB will involve this, especially this paradiscal space. Yeah, paradiscal space, and if there is involvement of this paradiscal space, this TB will cause collapse of this vertebra. Okay, and to treat this, we can do two things. We can do surgery at the same time, and we also need to start with ATT. So this going in between, it is known as middle path regime. Okay, it is known as middle path regime. Okay, this is the vertebra, this is the vertebra in between the disc. So in TB, there is this disc involvement. That's why collapsing of the vertebra will be seen. Okay, yeah, good. That is the middle path regime, and the name of this thing, spinal TB, is known as pot spine. And they asked this about this TB of hip. Okay, or in this TPF if you see, the most common site it is the acetabular roof. It is the most common site of this TB hip. Okay, the second most common site it is this epiphysis of this femur, and third one it is this metaphysis, and fourth one it is the greater trochanter. So these are the sites where TB can go and settle down in hip. Okay, and there are few stages: stage 1, stage 2, 3 and 4. Stage of synovitis, early arthritis, stage of arthritis and advanced arthritis. See, in the case of synovitis, you will feel pain. So what you will do, you will flex and abduct. So you will keep for the position of ease. Like if you keep it somewhat distant, you will feel some relief, right? Relief from the pain. So it is the flexion, abduction and external rotation. Okay, flexion, like for example, when you want to free, you will go to the bed and you will lay, right? So likewise, you will externally rotate and you will keep your leg abducted. So it is the stage of synovitis, and followed by this, everything will be the same. It is the flexion, adduction and internal rotation, flexion, adduction and internal rotation, and flexion, adduction and internal rotation. And because of this, there will be happening of this thing which is shortening. Okay, there is an infection or the infection or the bone will got affected and there will be starting of the shortening. Okay, bas itna yaad rakho. Synovitis mein there will be, you need to keep, there is inflammation going on, there will be a painfulness, so you need to keep at the position of ease where we will do this abduction. You will keep your leg outside and externally rotated. Okay, itna yaad rakho. Next, about these few instruments we'll see and we'll wind it up. Fine. If you see about this knuckle bender splint, where you will use this knuckle bender splint, you will see in the case of claw. Okay, where you will use this cock up splint, a good Dr. Ansh, good Dr. Quinin, good Dr. Shanavas Khan. It is what it is this cock up splint. Where you will use this cock up splint? Yeah, cock up used in the case of radial nerve injury. And where you will use this aeroplane splint? You will use this aeroplane splint in a case of brachial plexus injury. Fine. Yeah, good. Then this is this Adams forward bending test used for identifying the scoliosis. Yeah. No. It is the Schobers test. Schobers test we use for anterior test. That also will use tell them to bend. Whereas here we will be able to see the symmetry. It is what it is the scoliosis will use. Okay. Whereas in the case of the Schober test, he will be having painful detection. Here there will be no painful in the case of scoliosis. And we'll use this type of brace where see there is the support here. Okay, one rod on anterior and two rod posterior. It is the Milwaukee brace. Whereas if you are able to see, there is a pass at the level of axilla. Axilla ke piche ek pass hai, so it is the Boston brace. Next, this is the Taylor's brace for TB spine, which is the spot spine. Then this is known as our Jaipur foot. It is the Jaipur foot for after this rehabilitation. Fine. And this is the dynamic hip screw. Okay, this is the dynamic hip screw. Then initially there is a fracture of the head of femoral. Then we'll keep this dynamic hip screw. This is screw and this is movable, so it is known as dynamic hip screw. Fine. And there are these two processes which is known as Austin Moore. So Moore matlab there is more. There is a more holes. So if you are able to see this type of holes in this this arthroplasty process which is used for this partial arthroplasty in the case of head of this femur, this is what this osteomyelitis process is. Whereas if you are able to see there is no holes, it is the Thompson prosthesis. Yeah, Thompson prosthesis. Yeah. That's what, like, this is the questions which you often get, because these are these topics. That's why it is a must known important topics. That's why we are having this game changer. If you know this, your game will be changed. You will be out of this race. If you are 149, you will be getting 150 and you will pass the exam. That is the game you want now. Okay. Next, you will see this type of circular one. It is what it is. This Ilizaro. It is Ilizaro one. This is an external stabilization. Yeah, name changer from a just doctor to this registered doctor in India. Okay, feel kaise hota, theek hai na, just doctor to this registered doctor. You know, that is a really, like, when you have this number now, you can tell hello, okay. No, that is an alag feeling. You will come. Okay, and good time will come for you. Like, we'll pray for you and just keep your work hard and you just be consistent with this work. You will be coming out with flying colors. Okay, itna to mujhe pata. Okay, so this is this ring shaped one. That is the iliceral fixator, and if it is straight or parallel one, it is the rail fixator. It is a rail fixator. And next they will, sometimes they will give you this ring of X-ray. This is the same ilicero fixator. It is ilicero. Okay. And this is the bone cutter and bone holder. And we saw in the case of unusual bone, in the case of unusual bone cyst, we need to remove this inside hemorrhages. So we need to remove one by one. So we'll use this type of scoop, which is known as unusual bone scoop. We just call it as bone scoop. We'll call them as bone scoop. Okay. And these are the 3 pins. Okay. See, this is the K wire. Okay. This is Steinman pins. These are 2 pins, K wire and Steinman pins. Okay. Usually K wires, they are very much thin and used in distal procedures. Like for example, in the case of olecranon fracture, they will use this thing which is known as tension band wiring. Or if any fracture here, you just put up this K wire and do it. Okay. So these are all about this orthopedics part that you need to know. Okay guys. Bye bye guys.